everyone. I hope you're having a good evening. Before we get started, I wanted to thank everyone, especially Annie Yen and Alfred Liao, for inviting me to speak with the Joint Chinese College Alumni Association. It's an honor to speak with you guys. I've had a great relationship with both of them, and I hope to meet some of you in person in the future. So I've been invited to speak about how our oral healthcare changes with age. And I think what I've learned over time is that a lot of patients, they recognize that their body will change with age, but they don't recognize that their teeth and their mouth, like the whole, how that is also can change. So I wanted to show a few things about what can happen. And I am happy to answer questions at the end of this program. All right, so let's go ahead and get started. So let's talk about how our oral healthcare will change with age, and I'll talk a little bit about implants as well. I am a general dentist, but I am a board certified specialist in dental implants. And so what that means is that we actually have to go through several different levels to actually get these credentialing awards. And so I've gone through the AAID, which is the American Academy of Implant Dentistry, and I've had to go through a lot of continuing education hours, taken several written and oral exams, and I have to have shown many, many cases and defended my cases in front of many different dentists before I could actually get my board certification. And in Greater Houston, so this includes Clear Lake, Tomball, Galveston, Katy, everywhere. Houston is so big. There are only 14 dental implant specialists. I am very, very proud of this award, and it's taken me 15 years since I graduated to get it. And I am one of the younger people to have gotten it, but that would be more due to my dad. So I think that a lot of you do know my dad is Frank Sung, um, and have many other different credentialing awards besides these, but these are the top three for general dentistry and implants. And my goal in life was always to see if I could ever become as good as my dad. So it took me 15 years to get there, and I really have to thank him as well. So let's talk about one of the most common questions I get from patients. They often ask, why are my teeth falling apart? I didn't have this problem when I was younger. Well, I'm going to talk about a few factors that cause our teeth to fall apart. Now, don't be afraid. There aren't that many people who have this kind of mouth, but I definitely see it pretty often. But a lot of you guys don't have it. This person actually happens to do drugs. So that's fortunately not a lot of the patients that I see. But some of the major factors that we do see are due to saliva, which is our koshui, which is basically the fluid in our mouth. Another one is gum disease, tooth fractures, our teeth shifting, and then last I'm going to talk about bone metabolism. Just to give a brief background, you have to remember that we are born with two sets of teeth. So our first set of teeth are actually our baby teeth, and we have a total of 20 teeth, 10 on the top and 10 on the bottom. And when you compare these teeth, you'll see that they're much smaller. But as we get older, our skeleton is changing and our muscles are becoming stronger, our bones are becoming stronger, so we can tend to use a lot more force. So that's why when we get older, we actually need more teeth and we need bigger teeth. And if you look at the teeth in the back, they tend to be a lot wider. And then you look at the teeth in the front, they're a lot smaller. So the teeth in the back, they take 3 times more force than the teeth in the front. And so we have a total of 32 teeth, 16 on the top, 16 on the bottom. With proper care, all 32 of those teeth can actually last a lifetime. But as we know, a lot of people don't end up being able to keep all of those teeth. A lot of people ask me, I have all these other teeth, is it really worth it to save it? Like I said, each tooth actually is shaped, every single tooth is shaped a certain shape for a certain function. And teeth are definitely valuable for us. We get our adult teeth by the time we're 12 years old. And so assume that you have those adult teeth up until you're in your 70s. And so that's about 60 years. And assume that you eat about 3 meals a day, then we are using it for roughly 65,700 times for those 60 years. And assume that you just eat for 10 minutes for each meal, and then there are 50 chews. Essentially, we come down to using each tooth 33 million times, which means we are using them a lot. They're very important, not just for function, but we also use it to speak, and we also use it for looks. So permanent teeth, they are meant to last our lifetime, but unfortunately, a lot of our foods have a lot of sugar and acid, and human nature is to not want to brush and floss our teeth all the time. What a lot of people don't realize is that we constantly have bacteria in our mouth, and we have always a mix of good and bad bacteria. So this is what we call biofilm. But when biofilm is mixed with food, it actually turns into plaque. So this is someone who probably hasn't brushed in roughly about 2 weeks. It doesn't take long to get to this point. But you see that the teeth look really gross. There's this yellow brown stuff everywhere. But what's more important is look at the gums. People don't pay attention to gums a lot because, they just don't realize the importance. But gum is always more important to us because gum is like our skin. It actually protects our bone and it protects our teeth. So you see how the gum is really red right around the teeth? That's the inflammation. So pretend that you cut your skin and then it becomes really red and it bleeds. That's inflammation. But if you have enough inflammation for a long enough time, it turns into infection. So that becomes a much bigger deal. So plaque, as we know, it will contribute to cavities. And let me tell you that everyone has the bacteria to cause cavities, and everyone has the bacteria to cause gum disease. Everyone is born with this bacteria. The problem is that some of us genetically will have more bacteria that causes cavities, and some of us will have more bacteria that will cause gum disease. And some are just a good balance. And some of us, the very, very lucky ones, they have a very low amount of the bad bacteria that will cause cavities and gum disease. So every person is going to be different. But when you eat a lot of sugary, starchy foods like any carbohydrate essentially, and then you mix it with the plaque, it creates an acid. And then a lot of the foods that we eat, like let's say tomato paste, lemon, you add lemon to your water, any carbonated drink that has bubbles, right? So anything like wine, tea, and coffee, all of that also have acid. You add vinegar to your food that has acid. But that acid, along with the acid that's created from when the bacteria mixes with the plaque, will start to cause a cavity. And each acid attack can last about 20 minutes. So our teeth are constantly getting cavities. But if we have good saliva, then we can actually neutralize the acidity in our mouth. So if you are a healthy person with a lot of saliva, it only takes about 20 minutes to neutralize the pH level or the acid base balance in our mouth. But as we get older, we tend to have a lot less saliva. So there's some people who have dry mouth. It can take up to 7 hours just for their mouth to become neutralized. And that's why they tend to get a lot of cavities. Some cavities, if they're still really, really small and they're just in the outside part of our tooth, they'll stay that way. But they do not go away by themselves. So once cavities get to a point where they are in the middle part of our tooth, it becomes irreversible, and that's when it needs to be repaired by a dentist. So how do we get rid of acid? One of the things that you do is you need to have saliva. I'm going to review more about saliva in a little bit, but another thing is drink a lot of water. Try to keep your mouth hydrated. Another thing is you can actually use something like Trident gum or Orbit gum. After you finish eating, if you chew gum, it'll actually start to increase the saliva in your mouth. But what's very special about Trident and Orbit is that they have a specific sugar called xylitol, and that does not cause cavities. But if you use another gum like Bubble Yum or Big Red or Icebreakers, that does not have the right kind of sugar. So don't necessarily use that. Or you can just rinse your mouth with some water, and that can sort of act like a saliva, just not as good. Of course, it's very important. You have to brush, you have to floss. You need to go see the dentist, not just when you have a cavity, but you need to, or when you have pain, but you need to go visit the dentist on a minimum of once a year, ideally 2 times a year. For some people who have really, really dry mouths, they can be 3 to 4 times a year. The last thing is you need to make sure you make good dietary choices. So I see some people say, oh, I don't drink those sodas anymore. So instead I drink sparkling water. Little do they know, sparkling water has a lot of acidity. It's not as much as Coke or Dr. Pepper, but it still has a lot of acidity because it's carbonated. Just a reminder, when you brush, please, please brush at the gum, especially when you get older. Um, People, they tend to, like I said, they always forget how important the gum is, but you need to have the toothbrush half on the tooth, half on the gum. So and when we brush, don't just brush the fronts of your teeth. If you look at the image 3, it shows that we're cleaning on the inside of the mouth, and the toothbrush is more on the gum versus the tooth. And majority of the cavities that we see are on the inside where we cannot see it. So please brush every surface. You should be brushing twice a day. And don't forget, you have to change out your toothbrush every 4 months, or at least until the bristles flare out. So what that means is you see the toothbrush, there's one that is new and there's one that is old. If your bristles are flaring out like this, that means you're either you've been using this toothbrush for too long, so past 4 months. But if it's been less than 4 months, you're at 1 to 2 months, it means that you're using way too much force. And if you use too much force, the bristles flare. They cannot get into the crevices of the teeth where the gum is. And then that's when you start to get cavities. The other thing is when the bristles are flared out like that, they actually will start to wear away at your teeth more. So sometimes people will use their fingernail and they say, hey, why do I have a notch at my tooth? It's because of this kind of toothbrush. Change out your bristles. A lot of people say, oh, I use an electric toothbrush, so it should clean for me. That's like saying, no matter what, technique is the most important thing. If you're not brushing at the gum, you're still not getting the plaque. So I always ask everyone to show me, how do you brush? And most of them will not brush at the gum. So whether you use electric or manual, I really don't care. Just make sure it's at the gum. Floss. I don't care if you use string floss or one of those floss sticks, but please floss. Floss is always the best thing. One of the most common things I hear is I use a water pick, so it cleans my teeth really well. That is absolutely not the truth. A water pick is great if you don't do anything at all, but it never will replace floss. It's like going to a car wash, a touchless car wash that doesn't have any scrubs. And you'll often still see that there's some kind of bird poop left on your car. Or it's like taking a shower and not actually using some kind of wash towel or a loofah and just letting water, rush at you. You're not truly cleaning yourself. You need mechanical removal. So floss your teeth gently and do it once a day. And the best time to floss is at nighttime. Last, we're going to talk about nutrition. We've talked about carbs. Carbohydrates are bread, cereals, cookies, all of that. But as we all know, it's very important to have fruits, vegetables, protein. We need to have a good balance of everything. But if the majority of your diet is carbohydrates, you're more likely going to have a lot of the issues like cavities, but you're actually more likely to get gum disease, which I'll review more later. So let's start with saliva. I think I've talked a lot about how important saliva is to me, and it is to everyone else. But people do not realize that this is the body's natural way of fighting cavities. It has 4 main functions. The first one is that it dilutes and eliminates the sugars and other substances. So it basically is helping to wash away a lot of the food debris that's left on our teeth. Number 2, we've talked a lot about acid-base balance, but a lot of the foods that we eat are acidic. And so it actually helps to neutralize the pH level. And when you are younger, it only takes 20 minutes, but as you get older, it can go to an hour and a half. It can go to 3 hours, which are what most people are. And for people who have had, radiation from cancer or maybe have an autoimmune disease like Sjogren's, I mean, that will take 7 hours. A lot of people don't realize that our teeth, it only takes about 7 to 8 hours to have a cavity form. And our teeth are constantly demineralizing, so forming cavities because there's acid, but then they also remineralize from the saliva. The saliva actually carries a lot of nutrients. So some of it, fluoride will help to remineralize, right? So we have fluoride in our water, we have fluoride in our toothpaste, our mouthwash, but that's what helps to remineralize or help you to not get cavities. But saliva actually has calcium phosphate, which will help to also remineralize your tooth so you don't get a cavity. And of course, it actually carries your body's natural immunity, which is if there is some kind of inflammation, it helps to calm it down. There is some antimicrobial action there. So what decreases saliva? The number one thing is medication. A lot of us are on medications. A lot of us have hypertension, or we have trouble sleeping because we have anxiety, so we take sleep aids. So taking melatonin. Well, in Houston, there's so many people have allergies. So if you're taking allergy meds, you'll have that. But pretty much every age, the older we are, the less saliva we have. Stress, the more stressed you are, you will see that you have a lot less saliva. And then just disease in general. So some of the medications that reduce saliva, taking a screenshot of some of the things that you see here, but if you look at it, a lot of you guys are on this. When I meet someone, I always check their medical history. And when I see what they're taking, it definitely plays a factor into how I treat someone. But some of the main ones here are high blood pressure. The other one is decongestants, right? So if you're taking Benadryl, you're taking Zyrtec, you take anything for your allergies. Some of you guys have to take muscle relaxants. The next page, antibiotics. A lot of you have to go on antibiotics when you have an infection. Antibiotics, pretty much the side effect for any medication is to have decreased saliva. Another thing is factors that reduce saliva. Age. Women in general, they tend to have less saliva. Dehydration, if you're just not drinking enough water. We list here disability, institutionalization, habits. Some of you guys are mouth breathers, and that is something that, that's a much bigger topic, but a lot of you guys have undiagnosed sleep apnea. Also, whenever we are congested from allergies, we tend to breathe from our mouths as well. When we get older, we have less skin elasticity, so we tend to snore more, and you'll often see that your mouth opens when you snore. Smoking, drinking alcohol, compromised masticatory function. That basically means, we start to lose some teeth over time. When you start to lose teeth, you're not eating as much. When you don't eat as much, you tend to have less saliva. Oh, another one that's really important. Quite a few patients have autoimmune diseases like lupus, Sjogren's, rheumatoid arthritis, Crohn's disease, ulcerative colitis. These are pretty common, especially in this day and age. Stress is very, very related to autoimmune disease. And a lot of the patients who have this are women. Diabetes, that's huge. Hypothyroidism, so many women especially have this. People who have had stroke, Parkinson's, Alzheimer's. Then we talk about the psychological factors like stress, anxiety, depression, eating disorders. Quite a few Asians have hepatitis. This is also another one. Last thing here, we talk about chronic fatigue syndrome, burning mouth, fibromyalgia. A lot of people actually have this, and especially the older you get, I hear people, they tell me that they have liver issues, kidney issues. You have uncontrolled diabetes, you're going to end up having kidney issues. So these are all factors. Almost every patient I see has this if they're older than 65. So cavities, a lot of people, they get cavities, they say when they're younger, they didn't get it, but now when they're older, they get it. And this can be due to a lot of different reasons. The three main reasons, though, are trauma. So dentists, we say abrasion, but abrasion or trauma can be from anything. That can be from when you grind your teeth, or maybe you eat a lot of hard foods like almonds, Or maybe when you're brushing too hard, or you're using a medium to hard bristled toothbrush, or you're grinding your teeth. Grinding is moya, right? So a lot of people, they don't even realize that they grind. I myself did not realize I grinded my teeth until 2 weeks ago when I used something to check it, and I definitely grind my teeth. Clenching, what people don't realize is that at rest, our teeth should not be touching. So our teeth should only touch roughly about 20 minutes a day. So if your teeth are touching more than that, that's actually called trauma. Erosion. Erosion is from the acid. I think we've talked a lot about acid, but the acid is obviously from our food. It's from plaque that is causing a cavity. We get that kind of acid. And then the very last one, which a lot of you don't know, is attrition. Attrition is just our teeth starting to wear down, and that's primarily from grinding. So if you look at this person's tooth, I take a lot of photos when I'm in the office because people just don't understand, but when I talk about it, but when they see a photo, it's a lot more obvious. But this patient had a large silver filling, and when you look at it, you can see there's a massive cavity, there's a massive gap. Most of the filling is actually intact. It's more the tooth. But this tooth actually has all three issues here. There's trauma. This patient loves to eat nuts, and you can actually see cracks starting there. There's a lot of acidity. And so when you see that most of the tooth is white, then you have the silver. He has a white outer lining. That's what it should look like. And then, of course, you see the silver filling. But you see that yellow brownish area, that's acidity wearing away enamel. And so when it wears away, you get into the dentin, the middle layer, and that's a super soft layer. And it's much easier to get a cavity there. So if food gets stuck in there, you start to get a cavity. And of course, grinding. This patient is a grinder. You grind, it can actually start to make the tooth shift. People don't realize, but teeth are actually, they're constantly flexing. Flexes too much, you start to get a crack, the filling starts to come apart from the tooth, and then, of course, you create a space where food gets stuck and gets a cavity. This is another common one. This is a tooth-colored filling. Same thing, last tooth, but you see the brown around it, and then the white filling has started to crack, and then you create space for bacteria to enter, you get a cavity. But to give you an idea, cavities can come in all different areas of the tooth. The most common one, the one that I showed you, is coming from the eating surface of the tooth. That's what we call a pit and fissure cavity. The second one can be from the side of the tooth, which is a smooth surface cavity. And that can be due to a lot of different factors. A lot of it is from brushing too hard or from grinding our teeth. And then the very last one is a root cavity. And this picture doesn't portray it correctly, but root cavity is more pertinent to people who are older. So there are three main parts to our tooth. The outside is called enamel, and that is the hardest substance in our body. That is our body, our tooth's armor. There's nothing harder in your body. Your fingernails, your bone is nothing compared to enamel. But when the enamel gets worn away or it gets cut through, you get into dentin. And dentin has so many different functions, but the problem with dentin is it's really soft. So every toothpaste, with the exception of baking soda, is harder than dentin. So toothpaste will often start to wear away at dentin. So if you're brushing too hard, if you're using a lot of toothpaste, if you're using a whitening toothpaste, if you're using charcoal toothpaste, please don't use charcoal toothpaste. But that is going to cut right into the dentin and you will get a cavity very easily. What I do want you to note here is that this root cavity is closer naturally to the nerve, okay? So now the pulp. The pulp is the most important part of your tooth. It holds your nerves and it holds your blood vessels. And this is what causes, this is the life force of your tooth. So I do want you to note that in the tooth, it's a lot bigger, but when we get into the roots, it gets very small. And then they do connect to the nerves and blood vessels that are in the bone. Now, root decay. Root decay very rarely will happen on anyone less than 50 years old. Most of the time we see it around 60 and up. But this is the most common one. The main reason is that As we get older, we'll start to see that our gum recedes. And so there's more of the tooth exposed and there's no enamel, and thus we see dentin. And like I said, dentin is very soft. So once that root is exposed, then, and you're not brushing at the gum, you'll start to get cavities. The second main reason is because saliva, we don't have as much saliva, and a lot of people don't brush as well at the gum. Remember when I showed you before, let's go back to this, but a root decay, when you get a cavity on the root, it's naturally closer to the nerve. It only takes about 3 to 6 months to get to the nerve. So when you get it, it's really quick. When you have to do a filling, you will tend to be more sensitive on those teeth. As opposed to a cavity that's on the pit and fissure on the smooth surface, it will take about 3 to 5 years or more sometimes, depending on how old you are, for that kind of cavity to get to the nerve. But when you're at a root cavity, it very quickly, it's so quick. So like I said, please brush at the gum. Use a soft toothbrush, brush at the gum. These are some photos I've taken in the mouth, but a lot of people, the one on the left, that person loved to brush their teeth super hard and use a lot of toothpaste. You do that, what's going to happen is that you'll actually injure the gum, and then the gum will start to recede. And then you can see the root is exposed there. And this person has had a lot of fillings done there, but of course, over time, the filling will start to fall out because our tooth will start to flex, will start to move. And I told you, teeth are constantly flexing and moving, but these tooth colored fillings, they're actually made out of plastic, and the plastic is a lot more rigid. So when you have two things that have a different modulus of elasticity, the one that the tooth flexes, the filling doesn't flex, the filling's going to pop out. So, people always tell me, I had a filling there before and it came out, but I don't think I should do a filling there anymore. Yeah, some areas you don't need a filling, but in this case, you can see that it's starting to turn a little bit more orange, right in that middle. You're getting close to the nerve. You need to put a filling on something like that. At a minimum, a filling, or you could look at doing a gum graft. Here's another one on the right side. That's someone who has a cavity. That's a typical root decay, and the person did not floss very well. Well, that's a very common one that we see. This is another common one. This person has had a filling at the gum and also between the teeth. Naturally, the gum is receded, not flossing very well, not brushing at the gum. You start to get the cavity, and you see that the brown and black everywhere, right at the bottom. This is typically how it works. The gum will start to recede. You'll start to see that stain on that root, and then it slowly gets deeper, deeper. Then that's when you need the filling. Fracture. This is so common, especially people, everyone is a little bit different, but some people, they have a square shaped jaws. If you look at them, they almost sort of look like bulldogs. Or maybe some people, you look at them, they have bigger cheeks. Those are the ones that they have stronger muscles, so they can actually exert a lot more force. But what will happen is that if you are genetically predispositioned to have something like this, an average person will exert about 180 to maybe 300 PSI when they are biting hard. But then someone who has a square shaped jaw or has very strong cheek muscles, they can exert 600 to 800 PSI. And that's why the teeth can crack more often in some people versus others. There are a lot more reasons for fractures, but that's one of them. Another one is naturally the tooth, as we get older, our teeth, they tend to have a lot less blood flowing through it. And so every time you traumatize your teeth, like you start to get a cavity, or you maybe have gum disease, or you love to eat hard foods, what happens is that the pulp, which is the space that holds your nerves and blood vessels, will slowly become smaller, 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 because we're creating dentin, which is the middle layer. And that way your tooth becomes less sensitive. But that is your tooth's natural way of dealing with trauma. But when you are building more dentin and you have less pulp, then you start to have less blood or less space for the blood to flow into the tooth. And so that's why a lot of people, as they get older, their teeth, they don't really feel anything to cold. I mean, there's a certain point when that happens, but when you don't have blood, your tooth will start to fracture. That starts to happen right at the age of 45 years old. And so that's why we tell people you can eat nuts, but eat them sparingly. Don't go to Costco and get that whole big jar and then just start watching your Chinese soap operas for an hour and a half and 2 hours and eat like more than one handful of nuts. You will fracture those teeth. So here's an x-ray. I found two patients of mine. One was 22, the other is 72. But you look at the 22-year-old, you see that black space in the middle of each tooth? That's our pulp. That's where the nerves and blood vessels are. But then now you look at the 72-year-old. So I think it's a little bit more obvious on the right-hand side. That last tooth, you can see here how small that black space is. You can hardly see it in the middle of the tooth. It's so tiny. So look at the last tooth on that lower right, and then compare it to the x-ray on the lower left. It's so much smaller of a space. So there's a lot less blood flow. And I thought this was a perfect x-ray as well, but the 72-year-old, he has root decay everywhere. And of course, his tooth is fractured. He's got a root canal. Everything's starting to fracture. Here's some pictures I've taken in the mouth, but look at this, where the red arrows are, those are common fractures that we see on the teeth. The older we are, the more thin the enamel becomes, so the tooth begins to fracture. Very common. This was a tooth I just pulled earlier this week. This tooth was pulled for several different reasons, but fractured. So you see where the red arrow is? That's a fracture into the root. This is a root canal treated tooth with a crown. But this patient loves to eat nuts. And so they start to create this crack, 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 crack. And it doesn't really hurt them so much because they have a root canal, right? They don't realize what's going on. So they get this chronic infection starting. But once you get that crack, cracks don't go away. They just get deeper, deeper, bigger, bigger, right? And eventually it goes into the root. Once it goes into the root, game over, because that means there's always a space for bacteria to enter. And so that's how all the bone gets destroyed. And I thought it was perfect case here. Look at this is the same tooth. On the other side of the tooth where he wasn't flossing, he has a huge cavity. Gum disease. Remember I told you that everyone is born with a bacteria that causes gum disease. Everyone is born with a bacteria that causes cavities, but some people have a higher concentration of the gum disease causing bacteria. And once you actually start to get some gum disease infection, you will have it forever. That's why it's called periodontal maintenance. It's about trying to maintain a stable state, because you will always have that bacteria there. If you are not keeping it clean, if you're not being very good about maintaining it, in just 8 weeks, that gum infection will recur. There are some risk factors. Obviously part of it is genetics. I mean, there's some risk factors which are genetics. I see a lot of Asian people, especially Cantonese people, they tend to have this. A lot of Taiwanese people, they tend to get the cavities. Cantonese people get gum disease. It's interesting how it works out. But gum disease is a little bit different because gum disease actually is causing inflammation. And so when you have chronic inflammation or a chronic disease, there's so much research that shows that it can actually, there's a huge correlation with Alzheimer's, with diabetes, with autoimmune disease, with heart disease. IBD is inflammatory bowel disease. So when people tend to have these kinds of diseases, a lot of them tend to have some form of gum disease. It may not even be the full mouth. It may just be localized to one part of their mouth. And this is what's also interesting. They saw that if you have gum disease, you're more likely to have a more severe COVID symptoms, and you're more likely to have a worse outcome. Factors that promote gum disease is bacteria imbalance. I mean, that can come from anything. A huge one is stress. You get an infection, you have to take antibiotics, but obviously an imbalanced diet. So it's very important that you try to have a healthy lifestyle. So on this diagram, you see that gingivitis is not gum disease, but it's the precursor to it. So first you see that the gum is inflamed. And remember that first picture where I showed there was a lot of plaque everywhere? and the gum was especially red, that's the beginning. But if you don't you don't remove that plaque, within 3 weeks, it'll actually turn into tartar. So you see that plaque and tartar on the left side, that is really bad because tartar actually releases toxins and your body recognizes, oh no, there's something bad in my mouth. There's something bad there. So it'll actually send these anyways, but basically what will happen is that your body will try to help you to remove that tartar, but it can't because it's literally stuck to the root. And as a result, you start to lose bone. And so then the gum, you see how the gum is starting to detach from the tooth. So first, the gum becomes swollen, it detaches from the tooth. So pretend your skin now has an opening, and then more and more bacteria enters into there, and then you get more inflammation, and then you get to have increased bone loss. And then eventually you'll see that the tooth becomes loose because there's not a lot of bone holding your tooth. This diagram shows just how important it is to not have gum disease. So a lot of people who do come in with gum disease, they will often say to me once their gum disease is controlled, they're like, wow, I actually feel better in general. And they notice that they don't tend to get sick as often. I actually had this patient, he had implants done in Beverly Hills, had it done by this very famous dentist there. He had it for 14 years and he started to get an infection about 4 years into it. So he's had an infection for 10 years, but he started to have heart issues. He was having inflammation constantly in his foot. He was having depression. He was having insomnia. Well, first I had done, he didn't want to remove the implants yet. So I first just did a gum surgery on him to help to control the infection. And he said, wow, that's amazing. After you did it, 2 weeks later, he started to realize he was not having the inflammation in his Achilles tendon anymore. He was no longer having the PSVTs anymore. It's a heart condition. He was actually able to sleep again. He was not feeling so depressed. It was just amazing. But then naturally, 2 months later, started to come back. He was not taking care of it very well. He still wasn't brushing at the gum, and it came right back, and all his symptoms came back. We took out the implants. It's been 3 months. He hasn't had those issues. So gum disease. So a lot of people think, I have an implant. This is going to last me the rest of my life. No, the only thing that's supposed to last the rest of your life are your own natural teeth. So you have to take care of your implants. Implants are only the best replacement for teeth. I may be an implant specialist, but I want to save your tooth. I really, really want to save your tooth. If you know my dad, he wants to save your tooth too. It's only if we cannot save it will we say pull it. Then you go into an implant. Okay. But the thing about implants is, though they are the best replacement for teeth, they're not as strong as teeth. And I won't go into all of that. That's a little bit later, but we're talking about gum disease. Implants, they only have two fibers. And if you look at the diagram, on the right-hand side, there are only two kinds of fibers, and none of them attach directly onto the implant. So it is easier to get gum disease around an implant. But if you look at your natural tooth, we have 12 different fibers that attach onto our tooth and everywhere around our tooth, and they go in all different directions. So it's like this really hard lattice that's, imagine Mission Impossible and it has those lasers going in all different directions and Tom Cruise is trying to get through it. It's like that. It's hard for the bacteria to enter into there. But for an implant, they only have two fibers and they don't even attach onto the implant. So you have to clean well on your implants. Here's some of the stages that we'll see. It's a common thing that we see now, especially now that there are more implants out there. But the first picture on the top, this is early stage. This is, the gum doesn't look that bad. You look fine. But this is why we tell people in general, you have to go see a dentist at least once a year because you feel fine. Your gum looks fine. Your tooth looks fine. But then you take an x-ray and you see that you're starting to lose bone. The picture on the bottom, you can see that, they start saying, my gum's starting to recede and I get food stuck there more often. Look at this black triangle between those two, my two implant crowns. Well, you look at the x-ray, you see that you're getting more bone loss. That's a moderate stage, the second picture. Now, this last picture, this is very advanced gum disease on the implant. So we call it peri-implantitis. But you know how sometimes a dentist will use a probe to check around your gums. It's not because we're trying to hurt you. It's because we need to see how deep it goes. And we're checking to see if there's bleeding. We're checking to see how deep the probe will go. And it gives us an idea of if there's some kind of inflammation around the implant. And so this is pretty advanced stage. When you see something like this, it's just a matter of when will you need to remove the implants. So here's an example of a patient here. I did a gum graft on this patient. I put 2 implants on him. He naturally did not have a lot of good gum. He has very thin gum. And so we have 2 kinds of gum in our mouth. We have the actual gum that protects our teeth and is actually attached onto the tooth. But then the other gum is like you see on the before picture, you see how it's moving where the muscle is and where the cheek is. That's the other gum. And so a lot of people have this gum. And unfortunately for them, when you get something like that, that gum does not attach onto your natural tooth, and it definitely will not attach onto your implant. So he had ended up losing the tooth because gum disease. And I told him, we're going to put these implants in, but I have to tell you, you have to do a gum graft because you will lose these implants pretty soon otherwise, or you'll be dealing with a lifetime of gum disease around your implants, and we'll have to do constant surgeries to deal with this. So this is the after picture of the gum surgery. And if you look at the picture, you can actually see how now we have a thicker white tissue around that front implant and the back implant. And see when I pull the cheek, the muscle fibers, I don't know if you can see my cursor, but these are the muscle fibers. But the muscle fibers here, you don't see it. Okay. So when he moves his mouth and he's chewing and he's talking, he's not going to get food that goes right around that implant. This is another view of the exact same implants. You see, this is before. When I pull the cheek, you see the muscle fibers there. But then when you see the after I've done the gum graft, you see we have this nice thick band of tissue right around those implants. So that will help protect those implants. So on some people, I do need to do a gum graft. And this is something that I'm doing more and more often, because I will tell you, back in the 80s, the 90s, the 2000s, a lot of dentists had no idea how important the gum was around the implant. And now that we are seeing a prevalence of gum disease around implants, we are starting to realize, okay, we're going to need to start doing these gum grafts. And that's why this is a more recent thing that we've been doing. This is a video. I'm going to actually play the video, and this is after I've done the actual surgery. But I want to show you what it looks like just 6 weeks later. So you see when I pull the gum, when I pull the cheek, that gum isn't moving. That's like our skin. That is going to protect those implants. Sorry. Now let's talk about bone metabolism. This is such a common thing that I hear from women especially who have osteoporosis, but men can get osteoporosis as well too. Bone is constantly getting replaced. People think that bone is stable, that it always will stay like that, but it's not. Our bone is constantly changing. This is normal. Bone metabolism, we're actually at our peak at 25 years old, but after that, then you'll actually see that the bone is not getting replaced as quickly as the bone that's getting destroyed. So, of course, there are some other factors such as race, gender, but Asian people in general, they tend to have lower bone density. For example, bone mass in women, this is a really great diagram, but you see right around 25, that's when we're at our peak. And then after that, you see that we tend to have less and less bone. This is also something that I got from the internet, but this is perfect because I always tell people always ask me about implants. They say, hey, why can't I eat normally right after I've had the implant? Or why can't I eat nuts right after I've cemented the crown on the implant? That's because bone takes time to turn over. So bone actually bone turns over in roughly about 17 to 22 weeks. So that's roughly 4 to 6 months. And depending on a lot of factors like smoking, so the environmental factors, or diseases, like if you have diabetes, or if you have an autoimmune disease, or if you have osteoporosis, your bone takes time to mature. And so bone is often not hard enough to actually eat something as hard as a nut or eat something as hard as a steak until at least a year if you're 25 years old. And after 25 years old, it just gets slower and slower and slower. And so if your bone is not as dense, then the implants can start to get injured more quickly. And if you don't have implants, then your own natural teeth will start to actually move more. Remember, I told you natural teeth are moving. The less dense your bone is, the more it moves, easier for it to crack. Older than 50, you'll see that it becomes so much less dense. So some of the things I always tell people is, go see your doctor, check to see what your bone density is. Oftentimes they'll say, okay, let's have you take some vitamin D and some calcium. A lot of patients say, oh, I take calcium supplements, but they don't take any vitamin D. Calcium does not get absorbed into your bone unless you have vitamin D. You need to have vitamin D. And vitamin D comes in many different forms. Obviously, sunlight is one of them, but a lot of us stay indoors, right? So a lot of us have to take supplements, especially if you live in the Northeast, we'll have to take supplements. So go see your doctor. Sometimes you have to take osteoporosis medication. But I do want to tell you, if you are going to take osteoporosis medication, you have to be very careful. If you're going to do any surgery in the future, you do not take it past 5 years. So some people who are not good about seeing their doctor and they just somehow keep getting a refill of their osteoporosis medication, if they take it for too long, they will really start to suffer some issues. So we had a patient and somehow kept getting a refill, and she had had many implants done by my dad over the last 2 decades, and those were fine. The older ones were fine, but the newer one, when he had placed it, it was 3 years prior to when she started to get it. But she was totally fine after this crown was cemented, and then 3 years later, she started to get osteonecrosis. Osteonecrosis is when the bone does not turn over, and so you basically get dead bone. So your bone is not being built. You just get dead bone. If you have dead bone, your gum will not cover that. And then it's constant bacterial infections around there. So please be very mindful of your osteoporosis medication. Last one, teeth shifting. This is huge. It's one of the most common things I also get. People don't realize that their skull is changing. And so up until the age of 23, our skull is, which holds our top teeth, is growing faster than our jaw, which holds our bottom teeth. But after the age of 23, you'll actually see that your jaw grows more than your skull. And majority of us will start to grow forward and down. There, every once in a while, I get someone who grows the opposite way, but majority of people will grow like that. Now, teeth will shift for lots of different reasons. You have fillings, you get crowns. It cannot go exactly to what your tooth originally was before. Maybe you grind your teeth. Maybe you've traumatized your teeth by too much toothpaste, using a hard toothbrush. Maybe you have so much acid on. Acid makes the tooth softer, so your teeth can start to be ground down more quickly. But when your teeth become more ground down, they become not as sharp. So they slowly become more and more flat. The flatter they become, the less of a good bite that they have. So teeth will actually start to shift more quickly. When our teeth shift more quickly, they're not in a good bite. It tends to affect our TMJ. Our TMJ stands for temporomandibular joint. It is the most used joint in our body. So a lot of you guys have had knee replacements, but when you have a joint, you have two bones, and between you have a disc. The disc and the bones they have muscles and they have tendons and they have ligaments. But essentially what ends up happening is a lot of you guys will say, oh, my jaw hurts. And we find out that it's actually muscle aches. So sometimes you can recommend wearing a night guard to help to decrease muscle strain, or sometimes you can do Botox. That's a great thing. My associate dentist, Dr. Karen Yen, she actually does that. We've had a lot of patients who have actually improved after using that. A lot less muscle aches. And of course, we can get some ligament and tendon strain if it's very severe. And what I didn't write on here, but you can actually get arthrotic change, right? So arthritis is huge. We can get it in every part of our body. And one of the main things that you can do is you can actually get it in your joint, in our jaw joint. Bone is changing. Another thing I put in here is food impaction. When our teeth start to shift and you're not flossing, then you get that food stuck in there, or maybe you have gum disease and you get food stuck in there, it will actually start to wedge those teeth apart as well. Now, the thing though is that implants don't move, they just stay with the bone. So people often say, now I get all this food stuck around the implant, but I didn't have it before. That's because your tooth is moving, but your implants are not moving, okay? So here's some common cases. These were some that I just took this past month. But you see, both of these are implants, and you see that the tooth just in front of it has started to shift forward. Most often, it's the teeth in front of the implant that will start to shift, because remember I told you our skeleton, our jaw will start to slowly shift forward and down. And that's why all the teeth are starting to shift. That's why when you look at most people, their lower front teeth are quite crowded because their teeth are shifting. I'm actually currently taking a 3-year program in craniomandibular orthodontics. It's basically braces, but this is one of the things that frustrates me the most. The more I am learning about this, the more I realize that actually we can get our teeth to shift with our bone. And these cases that you see here, their teeth are not aligned. The way how their teeth are positioned, it's not aligned with their skeleton. And so as a result, you start to get these kinds of discrepancies. But there is a way to fix it. It's just a more comprehensive way. So I am currently in the process of learning how we can actually align our dental with our skeletal. But this is someone that I literally just saw last week. Look at her top teeth. You see, she has a bridge here. She said, hey, they used to be aligned with the rest of the teeth. Why is it going up? Right? And then you see a lot of her, she has implants on the bottom here. And then you see how her teeth now only bite on her right side, but they don't bite on her left side. Everything has started to change on her. This is typical teeth shifting. I unfortunately do not have a picture of what she looked like before, but this is a very common thing that we will start to see on people, especially as you get older. Now I'm going to go over some implant cases. I was also asked to show some implants, but here's a typical implant case. We see that teeth can fracture, and depending on how your bone is, if you have a bad infection, we can often, especially for a front tooth, we can pull out that tooth and immediately on that same day place an implant. And if the bone feels strong enough, you don't have very porous bone, like you don't have really bad osteoporosis, then we can actually put a temporary on the same day. And so this is what you see here on the other picture. This is another immediate placement. This is someone on the back. And I don't know if you can see my cursor here, but on this x-ray, on the upper left corner, you'll actually see this person. That person has not even had a crown, has not even had a filling on that tooth. But because he had that tooth in front of it pulled, now this back tooth is taking so much force. And eventually it cracked the root. When it cracked the root, he had to pull it. And so you can see in this case, we're able to put an implant in on the same day of pulling the tooth. And that shows the picture there. This is another one. This is someone I did 9 to 10 years ago, but he has root decay. He has a root canal and crown. He has large fillings. He's not flossing. And of course, he's started to lose bone. Same thing. We had to pull the teeth. He had a huge cavity. He had some gum disease. We had to pull the teeth, but because he had enough bone, we could put an implant the same day. And this is what it ends up looking like. Some people, though, didn't know that they could do implants, or maybe they had their teeth pulled a long time ago. When you lose a tooth, you will lose bone. In that first year, you will lose 30% of the bone. And every year after that, 5%, 5%, 5%. And so eventually what happens, first you start to lose the width. It slowly becomes thinner, thinner, thinner. And then eventually you start to lose the height. On this patient, she lost primarily width with a little bit of height. And so on a case like this, we can add bone. And you can see how on this first picture on the upper left, it's a knife edge ridge. It's tiny. You can't put implants in that. But it's still possible. You do a bone graft, 6 months later, we can put implants. 6 months later, we can put crowns. And this patient actually, this one is from my dad. This one he had done back in 2002, and we still see this patient to this day. Looks perfect. Here's another patient on his upper right. He had lost a tooth for a long time. Now, this is a different kind of bone graft. On our upper, we have something called our sinus, and we have 4 different kind of sinus in our head. But the biggest one is called the maxillary sinus, and this is the one that pertains to our teeth. The sinus, for a lot of people, is actually right above our upper back teeth. And so a lot of us will end up losing those back teeth. And then when you lose a tooth, what will happen is not only do you lose the bone that holds a tooth, but the sinus will actually start to become bigger and bigger. So this is someone who has lost it for roughly about, I think this one was roughly about 15 years. But you see how small that bone is? You need at least 10 millimeters of bone. This person has roughly about 2. So then we have to do a bone graft or into the sinuses. So we call it a sinus graft. And then 4 to 6 months later, we put an implant. 4 to 6 months later, we put the crown. In this case, this one actually had about 2.5 millimeters of bone. This one my dad did, and this is, I thought was a beautiful case. It's not often you can do a case like this. But usually for this kind of case, you'll first put in the sinus graft, and then you can put in the implant. In this case, he actually put in the implant and the sinus graft at the same time, and that's a lot harder to do than you think. We were very proud of this case. But you can see here he had about 2 millimeters, and then after that, this implant, 11 millimeters are into the bone. So that means he's lifted it at least 10 millimeters. And you can see on this 3D x-ray how much of that is actual bone graft. There's another sinus graft. We tend to get a lot of sinus grafts, but same thing, was wearing a partial denture, hated the partial denture. And of course, you can see actually how the bone, he's lost it horizontally and a little bit vertically. We add bone into the sinus, you get some implants here. Another common thing that I tend to get with patients is that they have a denture and they say their denture is becoming more and more loose as they get older. Well, the main reason is if you were wearing a denture, that means you don't have teeth, or maybe you start to lose, maybe you have some teeth, but there are lots of areas that don't have teeth. So of course you will start to lose bone. The shorter the bone is, the less stable the denture becomes. And for someone like this, she has had dentures for 30 years easily. And so you see this 3D x-ray, her bone is so thin, you can actually see the nerves starting to come out. And she cannot eat. But she tried all those denture adhesives, it will not stay. And especially on the bottom, it's so much harder to wear a denture on the bottom because our tongue is there. So whenever you are speaking, whenever you are eating, we use our tongue. The tongue has lots of muscles. When the tongue moves, the denture will move. So when you lose bone, your denture becomes less stable. And every year, you will see your bone will become less and less. And so people don't realize that a denture needs to have a reline on the inside of it about every 2 to 3 years because your bone will have changed enough. The bone changes enough, the denture becomes more unstable. The longer you wear an ill-fitting denture, so if the denture is not really stabilized on it, it will actually make you lose bone more quickly. And you start to lose bone more quickly, then the denture becomes even more unstable. So please don't just wear a denture and think, I have no teeth, I don't need to see the dentist anymore. You need to get your denture checked. So in this patient, we put implants, put a bar to connect those implants, and she has these clips inside her denture, and that's what helps to stabilize it. This is one that I did about 5 years ago. I'm sorry, I did not have a picture of before I cemented it, but she was sick of wearing her denture. She refused to have a denture like the one that you saw in the previous picture. She only wanted a bridge, but she had so little bone on the back, she didn't want to go into bone grafting. And so in a case like this, I was actually able to put 5 implants. We can sometimes do less. It sort of depends on what's on the top. Every person will be case dependent. But I put 5 implants, 1, 2, 3, 4, 5. And then we were able to create a bridge, just like what you see on natural teeth, and cement it. And I just saw her this past month. Looks beautiful. You see how nice and stable her gum is. And it's nice and thick. She's keeping it very clean. This is a patient I did roughly about 9 years ago, and her front teeth were literally flapping in the wind, cavities, gum disease, teeth shifting, everything. And so you get something like this, you cannot eat, you cannot smile. But she wanted something cemented, and she was only 48 at the time. So I've done a full mouth of implants on the top, full mouth on the bottom. We have a beautiful bridge. To this day, she still looks great. She loves to thank me on Facebook. I didn't make this one as pretty. I just put this one together, but this one I did 2 years ago, and he didn't even come for this. He actually was wearing a partial denture to replace these missing teeth. But there's so much on here. You see how he hasn't had the teeth on the top here, the upper front, for so long. So his bottom teeth have naturally started to move up, because what happens is that everything in our mouth is greedy. If there is space, your teeth will start to shift toward it. So he has a reverse curve here. Right now he is like this. It's supposed to be the exact opposite of that. And he actually came because he had cracked a back tooth. And I said, "Are you eating okay?" And he was like, "Not really." But we did something pretty conservative. We didn't replace everything, but we did just do his front teeth. And I have 3 implants on his top with a bridge here. And then you see his bottom. We did 3 implants on the bottom, and now he can smile great. This one here, gosh, when she first came in and she was in so much pain, we got rid of the infection, and she was like, "Yes, I realize it's time. I actually do something." She only could drink. She could not eat anything. There's literally nothing on her back. That's all you see. But that day, we pulled out all of her teeth. This is actually a case that is currently ongoing, but I pulled all her teeth on the top, all her teeth on the bottom. I have 8 implants on the top, 6 on the bottom, and this is the temporary that she wore that exact same day, and it was all completed in 6 hours. So she is really happy. It's the first time she can actually chew food. She hasn't chewed in so long, and she's actually chewing with these temporaries. So I do not do zygomatic implants. I do not plan to do it. I do know people that can do it. This is a very advanced level, but there's some people who have basically no bone. A zygomatic implant, they started doing it roughly about 15 years ago, but has become a lot more popular within the last 8 years. And a lot of people don't actually know about these remote anchorage implants. But when you have no bone, you can't, or maybe you can't go into the sinus, because some people, they have some really bad sinus issues, or maybe, I mean, there are a lot of different reasons for why you can't do a lot of bone grafting. Bone grafting takes a lot of time to build that much bone. Um, then there is always the possibility that you can do something like zygomatic implants, and that's where you put an implant into the cheekbone. I know that it looks really, really scary, but sometimes when you hear all on four, this is what they are referring to. And if it is something that anyone would benefit from, I just saw a patient a month ago who has been wearing dentures for many decades, and he's such a thin-boned person. No way to place implants unless you did something like zygomatic implants, and he is miserable. He cannot eat. I've referred him to go see an oral surgeon to try doing zygomatic implants. And this is really the other option that you can do. So to summarize, we've gone over a lot of different issues that can occur if you don't take care of your teeth. And I think we've recovered a lot of the main issues that occur as we do get older. If you do have any questions, I am happy to answer them. I know that we do have a Q&A session after this. Thank you.